Cold temperatures are here, and many people in the Northwoods are turning up the heat or lighting the fires in their homes. However, for people who have skin disorders, this could cause bad flare-ups. And here to tell us more about a specific skin disorder known as psoriasis is Nurse Christina Paris from the VA. So good morning, Christina, and thanks for being with us.
Hi, good morning. I'm glad to be here.
First of all, can you explain what is psoriasis?
So psoriasis, it affects more than 8 million people in the U.S. It's actually a skin condition that can cause parts of your skin to become red, thick, and flaky, but it's actually an autoimmune disorder. So when our cells, our normal skin flakes off, or as it dies, it kind of flakes off. And what happens is that people who have psoriasis, their skin grows really rapidly in that area. So for some reason, your immune system kicks in and it enters the bloodstream and it causes this thick, rapid growing skin. So it's not able to shed properly. That's what causes it to have that thick, crusty layer on the skin.
Okay, and are there some maybe common symptoms or areas of the skin that are commonly affected?
So common symptoms are going to be, you're going to have dry, red, maybe silvery, white, scaly skin. It can be itchy in spots. It can also cause joint pain, swelling, stiffness. You might have a rash on your groin or on your scalp, maybe at the nape of the neck, or in skin folds too. It can be there as well. And then triggers or things that affect it can be stress, injury to your skin, so if you get scratches, sunburns, bug bites, things like that. Illness, if you have bronchitis, tonsillitis, or respiratory infections can cause it. And then, as you mentioned, weather. So the cold weather can affect it too, because actually sunlight helps those people.
Great, lots of good information and things to look out for there. Another common skin condition we hear a lot about is eczema. So are psoriasis and eczema the same, or how are they different, I suppose?
They are not the same thing. So psoriasis is an autoimmune disorder, where eczema is more of like a genetic mutation of the top layer of skin. It also is more affected by environmental factors. Psoriasis too can cause more burning, where eczema is really, really itchy. So people who have eczema just itch and itch. Eczema is also sensitive to heat and sunshine, where psoriasis, people who go out in the sun, it actually slows the growth of those abnormal cells. And so the treatments for both of those are very different. And the best way to know the difference is to go get checked out by a dermatologist.
Interesting. And you mentioned treatment. So for people who are dealing with psoriasis, what are some of those treatment options?
So for psoriasis, there's medications that can be applied to the skin. Sometimes they use the ultraviolet light because that can help, like I said, slow down the skin. There's oral medications like methotrexate or different kind of retinoids that, like vitamin A, that can be used. There's also injectable medications, and sometimes just even improving your dietary or making dietary changes can also help with skin as well.
So much great advice, and we really appreciate it, and we look forward to talking with you again next week. Thank you so much, Nurse Christina.
You are certainly welcome. Have a good day.
You too.